Next is about Karnarogavijnana अध्यायं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः कर्णशूलं प्रणादश्च बाधिर्यं श्वेड एव च कर्णस्रावः कर्णकण्डूः कर्णवर्चस्वसेव च कृमिकर्णप्रतिनाहौ विद्रतिः द्विविधस्तथा कर्णपाकः पूतिकर्णः तथैव अर्षश्चतुर्विधं कर्णार्बुदं सप्तविधं शोभश्चापि चतुर्विधः एते कर्णगतारोगाः 28 28 of the Karnagata rogas are mentioned with the names like. Now the first is Karnashulaha. Samirnaha Shrotagato Anyathacharaha Samantada Shulamativa Karnayoho Karoti Doshishcha Yathasumavrataha Sakarnashula Katito Duracharaha. The Vata which moves around the area of ears. If it gets deformed, the track of the Vata gets deformed and may be moving in a wrong direction, can result in the shula, pain, which again involving the other doshas. Now this condition, the ear pain, is again a very complex situation. It can occur due to multiple causes. It's not a simple issue. It can be produced due to multiple causes, and primarily from the clinical point of view, we categorize them into two categories. That the primary pathology, that's where the real pathology in the ear would produce the pain, or pain that originates outside the ear but it is referred to, is called as referred pathology. So pathology is simply ear pain, and it could be of two categories, either referred pathology or the primary pathology. Primary pathology can be produced due to again multiple causes like inflammation in the area or neurological conditions in the area. And the secondaries or referred pathology could be produced due to multiple factors. Pathologies related to the nasopharynx, pathologies related to the intracranial conditions, pathologies of these sinuses, multiple sinuses, dental pathology. Very often it presents as the oral lesions, musculoskeletal lesions of the neck area, trigeminal neuralgia also can present with the patients with pain. So when a patient presents with pain in the ear, it's quite important to take the history, examine in detail and confirm like whether it's a primary disease of the ear or not. So when Sushruta mentions about the multiple causes like Shrotagataha Anyathachara Samantadaha, when it moves around, you'll have to consider all these multiple factors, and a single line of treatment may not be optimum. For such conditions, you will have to consider those issues. So whatever is mentioned in the next chapter, like Karnaroga Pratishedhadhyaya, is mainly about the primary pathology treatment than really the referred pathologies. Then Yadatu Nadishu Vimargamagataha Saeva Shabdabhivahas Tishtari Shnoti Shabdan Vividhan Sadanaha Pranadamenam Kathayanti Jamayam. Pranada or Karna Pranada is a Karnanada also is the other word, which is a situation where again there is an abnormality of the vata, and it produces abnormal sounds. Patient will feel the sounds, hear the sounds of different variety, and this is called as a karnanada, or what we call as a tinnitus. Tinnitus again is kind of two categories, an objective tinnitus or subjective tinnitus. Objective is because of the sounds produced within the body, in between to any of the organs, like moving bones or maybe the muscles, etc. A person can hear the sounds, and really there is a sound produced which may not be from the exterior. The body sounds which are produced within the body may be felt by the patient, which also may be considered as a tinnitus many times, or subjective. The more common which we see is the more common subjective condition, where the patient has a audible sound which is not audible to anyone else, like it's something like hallucinations, etc. So objective is produced due to anywhere any lesions within the body, like ear, head or neck, or muscular or vascular conditions. Muscular tinnitus is somewhat common than the subjective one. The subjective is produced more commonly Objective conditions often seen are muscular pathology like lateral sclerosis, where the muscles of the neck become weaker, and hence, when there is a movement between the bones, the sound is produced and the patient feels the sound. Many times, that sound felt by the patient could be more troublesome than the other. Now, the subjective is where there could be some neurological pathology where the patient may feel like hallucination and so on. The next of the condition is a Sayeva Shabdanvaha Yadasiraha Kapani Ato Venusratya Tishtari Tada Narasya Apratikara Sevinaha Bhavati Bhavetu Badhiyam Asamshayam Kalo. When the Shabdanvaha Sira, that's the structures which conduct the sound. When I say structures which conduct the sound, it means the nerves, bones, as well as the vascular structures, the vessels, which are necessary for the conduction of the sound in the ear. When they are deformed, that can result in a impairment of the hearing. Badhirya is not simply deafness, a impaired hearing, reduced hearing. When it comes to a critical level, then we call it as a deafness. Now, as far as impaired hearing is concerned, it is one of the very serious global issue, and according to the WHO, the incidence of impaired hearing is so high, like by 2050, it is predicted that by 2050, 2.5 billion people are projected to have some degree of hearing loss, and at least 700 million require hearing rehabilitation. That hearing rehabilitation, like the instruments, machines, or so on, all other facilities by which the hearing could be improved. So that's one of the possible future global problem. Causes are many. We'll come to that part. And the over 1 billion young adults are at risk of permanent avoidable hearing loss due to unsafe listening practices. Majority of that would be due to the lifestyle conditions where the practices of hearing the sounds, like either having very loud sounds heard, like the musical instrument, so on, RJs and so on, or making use of these electronic instruments, these music or other sounds through the ear by keeping a earbud, so on. So are the practices which can result in the deafness, and majority of them can result in a permanent pathology due to the self-created issues of impaired listening practices, and this could be around 1 billion people in future. And as for the economic burden, the financial burden, additional investment of about US dollar 1.4 per person is needed to scale up the ear and hearing care services globally. And over a 10-year period, this promises a return of nearly US dollar 16 for every US dollar invested. So if you keep that from the global point of view, economy point of view, if the hearing capacity of the citizens are improved, productivity would increase, and that will be resulting in the gain to the nation. That's what the WHO predicts as such. Now, as far as the hearing mechanism and the basic of hearing impairment is concerned, to be very brief, the hearing is a mechanism where the waves, sound waves, are converted into a neurological conduction or neurological impulse through the ear, and for that the mechanism is the waves will reach to the tympanic membrane, and the tympanic membrane would be vibrating, and that vibration would be felt in the tubes. That fluid in the tubes would be the trochlea. That fluid will be moving around, and that fluid movement would produce a stimulus in the cilia, the nerve endings which are present over the area, or that's what we call as scala tympani. And the nerve endings are specific for specific wavelength. Some of those nerve endings are specific for the broader wavelengths, some of them are for the shorter wavelengths, and majority of the nerve endings which are present in the lower surface are responsive for the broader endings. They move when the broader these waves are reaching over, and on the upper side the short waves are felt, and in between some of the nerve endings they would have a buffer action. They will prevent certain range of the waves of sounds from being conducted in. So the quality of the sound which is felt by a person would be depending upon this differential response of these cilia or these structures, nerve endings present over the vestibular. So and then once it gets stimulated, the conduction of the sounds will be again conducted through the main three bones, the bones, the primary bones, ossicles of the hearing, and this status of these bones also are very crucial to conduct that impulse into the fluid compartment. So vibrations are actually through the ossicles, the bones which are present over there, and this is important. In addition to that conduction of the waves through the air, there will be some amount of the conduction of the waves through the bones too. So even if the ear is closed and air is not allowed to go through the external auditory canal, still a person can hear the sound, because the sound waves may be passing through the bone, and this passage of the bone also can produce a similar response, and hence the sounds are heard through two mechanisms, air conduction and bone conduction. Actually, the air conduction would be more efficient than the bone conduction, and those I said about the hair cells, those hair cells which are having that different responses, some of those which are responsive for the 20 hertz, that's broader waves, and some of them are for the shorter waves, and hence that will produce the stimulus of the cochlea. These cells will be producing the stimulus of the cochlea, and that sound waves will be felt by the nerve endings, and hence the sound waves are felt in the brain, and in the auditory area it will be interpreted. That's how the sound is heard. From the basic clinical point of view, whenever a patient has a hearing loss, the first thing is you'll have to confirm whether that hearing loss is impaired, produced due to a abnormality of the air conduction or abnormality of the bone conduction. See, normally air conduction is better than the bone conduction. That's a normal phenomenon. Suppose if that patient has an abnormality of air conduction, that means the waves which are passing through the air are not converted into the nerve signals in between anywhere, due to either middle ear pathologies or maybe the impairment of the nerves conduction somewhere higher up. In any of that condition, the air conduction would be lesser than the one, and this is done by the Rins test. A tuning fork is hit and it kept is in front of the ear, close to the ear, till the patient is able to hear the sound. And once the patient stops hearing the sound which is felt through the this air, you keep it on the bone, mastoid bone, and see whether the patient can feel the sound or not. Actually, this patient should not hear the sound when it is kept on the bone. Suppose if the patient continues to hear the sound on keeping that tuning fork over the bone, that means the bone conduction is more. Or it could be the same test can be done the other way also. Hit the tuning fork, vibrating tuning fork is kept on the mastoid bone, keep it till the patient hears the sound, and once the patient stops hearing the sound, they bring that vibrating tuning fork very close to the ear, see whether the person can hear or not. Now normally a person can hear the sound even after the bone conduction is stopped. So that's how the normal function is assessed. If this is reversed, that means there is an abnormality of the pathology, abnormality of either the nerve conduction, or mainly the nerve conduction, or maybe the air conduction as such, would be made out. Another of the tuning fork test which is routinely done is Weber's test. That's to confirm which of the side of the ear is affected. When a patient has a hearing impairment, to confirm whether it is unilateral or the other way, and if it is unilateral, which side is affected. The conduction is the tuning fork is kept on the forehead in the midline, and which you can confirm like which of the ear is able to hear the sound or not, and that's how it has to be decided. So Rins and Weber's tests are considered as a very old or a very traditional tests of the clinical examination, and these hearing losses are categorized as a conductive hearing loss, or it could be due to sensory neuronal hearing loss. This is the usual term used, like conductive hearing loss CHL or sensory neural hearing loss or SNHL is predicted, or is a word which are used, and usually it is due to the sensory neuronal pathology is produced due to a disruption in the transmission after the cochlea. That's the cochlea and the ventricles are the ossicles, and then of course the nerve endings over there, over the tubules over there. Whereas conducting hearing loss is usually produced due to the external ear pathology. Causes of hearing loss and deafness. There are plenty of causes, and that could be in the prenatal period, that's before the birth occurs. Genetic factors, intrauterine infections like rubella or cytomegalovirus can produce a deafness at the time of the birth, which is due to the abnormality or damage to the nerves over the area. Then perinatal, after the child is born, it could be due to the asphyxia, that hyperbilirubinemia, low birth weight, or perinatal abnormalities, which can be produced at the time of the delivery or maybe slightly immediately after the birth. In the childhood, it could be ear infections or collection of fluid, that's suppurative or non-suppurative otitis media. Meningitis also can result in impaired hair loss. In adult, it could be any other chronic diseases, I would say, like diabetes and so on, age-related pathologies, or it could be atherosclerosis, that's the sclerosis of the bone, which we will be dealing with later on. Smoking also can be a cause for hearing loss. Across the lifespan, mainly the cerebral impaction, that these wax in the ear, trauma, loud sounds, which again more common now and more important now, loud noise or loud sounds. From the current point of view, that's one of the major causes for the impaired hearing. Then medicines, drugs which are toxic to the ear. Earlier streptomycin was well known. Now of course there are many other drugs which are added to these patients or persons who are working with the ototoxic chemicals. Some industries also can produce that. Nutritional deficiencies, viral infections, or delayed onset or progressive genetic hearing loss. Now, one of the important issues present from the current social point of view is whenever you use any instrument which enhances the sound, there is a legal limit that you have to limit that sound to the acceptable limits. The the administration has specified like how much of the sounds could be heard at certain specific distance from the point of origin, and that's the upper limit for each of these instruments. Sound is measured by a unit called decibel, and that decibel is simply a logarithmic presentation of the pressure produced sound and the frequency, and it is measured by a simple instrument, a dB meter. It's how the sounds are measured easily. Now, the acceptable limits of the sounds from and this intensity of the decibel heard by a person, and when it is considered as normal and when it is considered as abnormal, is if a person is able to hear the sounds up to 20 dB, that is considered as a normal, or at a level of 20 dB is considered as normal. If the person cannot hear the sound between up to 20, but in between 20 and 34 dB decibels, then it may be considered as a simple mild pathology of these hearing loss, or it's also called as grade 1 hearing loss, where the person may have no problem in a quiet condition and difficulty in hearing the conversation as such. Many times the person may not hear the sounds of speech. Then a moderate impairment of the hearing loss is when the sound heard is at an intensity of less than 34 dB, the person cannot hear the sounds. But in between 35 to 49 dB, if the patient is able to hear the sounds, then it is considered as the moderate difficulty, and usually the patient may have a very difficulty in the normal voice conversation. The patient may need to be spoken at very high loud sounds. Then moderately severe or grade 3 of impairment is when the patient needs a loud speech to hear in quiet and has great difficulty, and when the hearing range is between 50 to 64 dB. And if it's a very severe deafness, is in between 65 to 79 dB, and at that level we use the word deafness. Till the level of 3, it's considered as a hearing impairment or hearing functional losses, and this is how it is universally decided. And profound is when a person is not able to hear the sound in between 80 to 94 also, then we consider this as a profound deafness. So grade 4 and grade 5 are categorized as deafness, others are not. And this is measured or assessed by a simple instrument called as the audiometer, and the audiometry results are graphed. Usually when you refer a patient for that study, you will get the graph in terms of the hearing in both the ears, left and right separately. So this instrument, simple instrument, helps in that. And in that audiometry report, when you get that, you will have the normal range, that 0 to 20 is considered as a normal range. So if the hearing range, the lines are seen in this range, then we consider this as a normal, or depending upon these levels we categorize them as either mild, moderate or so on. So depending upon the location, even it comes lower, this line comes lower up to the 100, it's a profound deafness as such. That's how the audiometry is used. So that's in brief about the hearing impairment or badhirya as it is assessed now. Then the next is Karnakshveda. श्रमात् क्षयात् रूक्षकषाय भोजनात् समीर्ण शब्दपथे प्रतिष्ठितः विरिक्तशीर्षस्य सशीतसेविनः करोति हि क्षवेडम् अतीवकर्णयोः. Kshveda is excess of the cerumen secretion or cerumen becoming accumulated. Of course, Sushruta has mentioned that cerumen aggregation in different names. Karnakshveda, Karnagutha is another situation which is mentioned where there would be very hardening. From the current point of view, we use a single word called cerumen impaction. Cerumen impaction is when there is a collection of the cerumen, that secretion in which can affect the functions of the ear. That's called as a cerumen impaction. Cerumen is a normally protective secretion present from the epithelium of the otitis externa. For external ear, not otitis, external auditory meatus. The skin tissue has specific glands which secrete cerumen, and that cerumen is mainly having keratin, long chain fatty acids, cholesterol and dead cells. Now to remove this cerumen regularly is not really an ideal health issue, because these cerumen protects the ear from the secondary infections. It has a protective function. But when the layer becomes thicker or when it becomes hardened, consolidated, then it can impair the hearing. So it needs to be softened and then removed carefully, regularly. And to soften, now the substances used is the ceruminolytics, and they include hydrogen peroxide, acetic acid, doxycycline sodium and sodium bicarbonate. Most of these substances, they will dry up and further secretion of the cerumen will be easily hardened. Whereas the idea of putting oil, that this taila into the ear, taila purana into the ear, mentioned in the Samhitas as a sustarukta, they will keep that cerumen softer as well as the whole area smooth and wet as such, so that further secretions, further hardening would be lesser. But there is always a controversy. The ENT specialists now would always say that putting oil is dangerous and should not be used, and many of these current textbooks also say that. Of course, that fact is true if that oil is not cleaned properly, whereas the habit of putting the oil drops into the ear and then immediately after that cleaning would be a healthy practice, which will reduce this possibility of cerumen impaction, as well as it can maintain the hygiene. If the oil is put in and it is not drained out, then it can be a cause for the infection. So that part has to be very clearly understood, and that's one of the major controversy. Very common criticism about the practice of putting the oil in the ear is a very common thing, and in that issue we have to consider the fact that the oil should not be left over, it should be clear. Right? That's about one of the issues. Next of the issue is the karna samsrava. शिरोभिघातात् अथवा निमज्जतो जले प्रपाकात् अथवा विद्रदेहे स्रवेत्तु पूयं श्रवणो अनिलावर्तः सकर्णसंस्रावः इति प्रकीर्तितः. कर्णसंस्राव or कर्णस्राव, discharges from the ear. Again, the discharges from the ear could be of two sources, either from the middle ear or from the external ear. Probably Karnasamsrava is limited to the external ear, where the causes could be either dipping in the water or trauma or any other conditions which do not maintain the hygiene, due to the vitiation of the doshas, there will be discharges as such. Now, from the current point of view, we use the term otitis externa for inflammatory pathology of the external ear or the external auditory meters, and that could be again categorized as a acute otitis externa, acute diffuse otitis externa, often in swimmers, that's due to the water flowing in, or acute localized externa, which is furunculosis. Of course, Sushruta has used a different word for these conditions, where there is an infection of the hair follicle, which is categorized as Karnavridhri by Sushruta. Then chronic this otitis externa, where the as it is acute but it is present for more than 6 weeks. Eczematoid external otitis externa, again Sushruta has used a different word for that, encompasses various dermatological conditions. We'll come to that part, like what Sushruta has mentioned. Then necrotizing externa, also Sushruta has mentioned this as a karna, this gutha or kotha as such, necrosis, which is a different issue. From current point of view, all these conditions are named as otitis because they are the inflammation. But the degrees of inflammation, based upon the degrees of inflammation, they are subcategorized as a variations of otitis externa, whereas Sushruta includes many of them or considers many of them like the different names of the diseases. Now, kafena kandu prachivena karnayoh bhusham bhavet srodasi karna sanjitah. Karna kandu is the eczematous otitis externa, where there will be itching and there will be scaling of the skin. That eczematous otitis externa is a skin condition where there will be eczematoid changes in the external auditory meters, which are quite visible, either limited to the external auditory meters or they may even extend to the pinna of the ear. Now, present day situation, it is categorized as a sub-variety of the otitis externa, whereas Sushruta has considered Karna Kandu as a separate entity. Then Vishwashile Shleshmani Pitta Nanam Bhavet Srodasi Karna Gutakaha. Karna Gutaka is again a cerumen impaction where it becomes very hard. Now, in the present day situation, we use the same name like the cerumen impaction for all that degrees of cerumen blocked, but it should be like of a category where it has become hardened, and Sushruta can consider it as Karna Gutaka. Now, cerumen impaction and removal of the cerumen, impacted cerumen, is one of the very common techniques in the ENT practice. Now, sophisticated instruments also are available, more than simply that cerumenolytic substances. See, when cerumen impaction is when the cerumenolytics, that so-called dissolving substances, are not capable of dissolving it, it becomes so hardened that it has to be mechanically removed. That's the condition where you will have a hardened cerumen, and that probably Sushruta has considered this as a Karna Gutaka. Then Sakarna Vitko, Drautam Yadagato, Vilaito, Granam Kham Prabadile, Sulasakarna Pratinaha Samjito, Bhavet Vikara, Shiraso, Abhitapanaha. Now, a pathology related to the ear producing a impaction or discharges in the nose or maybe throat, nasopharynx as such, which reaches to the nose, that's considered as a Karnavitkaha. Karna Pratinaha. Karna Pratinaha is the name given over there. Now, Karna Pratinaha is actually due to that basically a connection, abnormality of the connection between the middle ear and the throat, and there is a variation of the pressure. Normally, the air pressure in the middle ear is mentioned or maintained at a normal level because of the eustachian tube being plated. That eustachian tube, which opens at the throat, very close to the nasopharynx, is the one which keeps that pressure equal. If there is something abnormal, some baby fibrosis blocked there in the eustachian tube, that results in a trapped air, and also there could be trapped fluid as such, which can result in the inflammation or maybe the pathology related to the internal middle ear, and that middle ear and internal ear can be affected. Significant functions there could be affected significantly. It can produce pain, it can produce impaired hearing, or even it could be resulting in ruptured tympanic membrane, or a tympanic membrane get ruptured from the external objects also, And there again, there could be an abnormality of these secretions. The secretions from the middle ear, instead of going through the aesthetic tube, they may be flowing throughout, and there could be again variation in the pressure there, and it can affect the hearing. And all these conditions where there is an abnormality of the pressure in the ear can be considered as a karna pratinaha. That's one of the issues. Then यदा तु मूर्छन्ति अथवापि जन्तवः सृजन्ति अपत्यानि अथवापि मक्षिकाः तदञ्जनत्वात् श्रवणो निरुच्यते भिषग्भिः आद्यैः कृमिकर्णको गतः. Krimikarnaka is a condition of maggot formation in the ears. It's again a common issue. Due to unhygienic conditions, maggots may be formed in the ear due to the flies laying their eggs, and the only solution is that it has to be mechanically removed and can produce a lot of discomfort to the patient. And incidence is not a very rare phenomenon. It's a common phenomenon, almost is somewhat more common in the people who do not maintain the proper hygiene. So that's about the krimikarnaka. Then kshatabhighata prabhostu vidradhi bhavet tata doshakrato aparapunah sarakta pita arunam asram asrabet pratoda dhumayana dahtoshavana. Karna vidradhi is a situation where there would be a swelling which is producing severe pain, burning sensation, or even discharges. Either it could be purulent discharge or maybe a blood stain discharge, serous discharge could be produced. Such condition is called as the Karnavidriti, which is exactly what we call as a furunculosis. Furunculosis can present as initially a swelling, or later it can present as a impacted these residual substances, exudates, which could be presented over there, and it could be painful as such. It's as good as furunculosis elsewhere. There is an infective pathology. Then bhavet prapaka kaluka pittakopadha pikotha vikleda karashta karnayoha. Karna prapaka is a condition where there is a necrotizing otitis externa. Now furunculosis, necrotizing externa, these are now categorized as a variety of otitis externa, whereas Sushila has considered them as a separate entity where there could be severe inflammation and necrosis of the epithelial surface, which can present with the acute pain, lots of foul smelling discharges, and the whole deformity of the skin, which can also be a cause for abnormality of the air conduction. Then sthite kaphe strotasi pittate sa विलायमाने वृषसुप्रतापवान् अवेदनो वापि अथवो सवेदनो घनं स्रवेत पूतिकर्णकः. Putikarnaka is otitis media, where there would be pus or inflammation in the middle ear, which can result in, again, will produce similar symptoms like a swelling in the middle ear pathology, producing acute pain, either acute pain, or Sushruta says there could be avedana, a pain may not be present, but can produce a putikarna, that pus can discharge. Pus can get discharged only when the tympanic membrane is ruptured. Now, in the present category, otitis media is categorized into acute otitis media with effusion, where there will be high accumulation of the fluid, pressure will be more, or chronic suppurative otitis media, which is more common. Majority of the patients whom you see in the clinic are chronic suppurative media or adhesive otitis media. Adhesive is where the ossicles, they become adherent to each other and they will not be able to move and impair the hearing. So that's the otitis media as such. Then the other conditions Sushil has not mentioned, the karna arsha, he has not given the detail. The ear polyps, they are the karna arsha. It's not a very rare condition. Polyps in the ear also are common. Many times they may be a source for the bleeding from the ear or pain in the ear, and which can be distinctly seen when you use a otoscope, and that's the karna arsha. Then karna arbuda, cholesteatoma, is a common tumor in the ear, and again there could be congenital cholesteatomas, which may look like a simple accumulation of a cheesy substance over that, or primary or acquired cholesteatomas. Secondary acquired cholesteatomas also are the varieties where you will see that mass, soft mass in the ear, which again blocks the external ear as the clinical signs. So that's about some of the diseases related to the ear mentioned by Sushila. प्रदिष्टलिङ्गानि अर्षांसि तत्त्वतः तथैव शोफार्बुदलिङ्गं यदिदं मया पुरस्तात् प्रसमीक्ष्य योजयेत् इहैव तावत् प्रयतो भिषग्वरः. Sushil has mentioned that the Arshas and Arbuda, they are discussed in the other chapter, previous chapters, and accordingly the same symptoms have to be assessed. And from that point of view, I have just referred to that Karnasha as the polyps and Karnarogavijnana as the cholesteatoma, the tumors. With this, we conclude this chapter. इति सुश्रुतसंहितायाम् उत्तरतन्त्रान्तर्गते शालाक्यतन्त्रे कर्णगतविज्ञानीयो नाम 20तमोऽध्यायः. So we will conclude today. If there are any questions, I will try to answer. Okay, there are no questions, so we will wind up. Right.